Hello and welcome to another Wellness Wednesday workshop. I'm Dr. Lori coming to you from Phoenix Family Wellness here in Phoenix, Arizona. Over the past few weeks we've been talking about whys, why of eating, why of exercise, and today we're continuing on with the most important why, and that's why chiropractic. A lot of people think chiropractors are back doctors, neck and back pain doctors, auto injury doctors. But really the truth of the matter is that we are nervous system doctors. And we focus a lot on the spine because the spine is what houses and protects that nervous system. Our nervous system is like a freeway of messages from our brain to our body and then back up to our brain. It's the communication freeway, and it really does communicate and control everything in our bodies. Not just the muscles around a particular area, but also organs and organ systems and how everything works together. Our body is really intelligent. It's a smarter doctor than we could ever ask to be. And it has inside of it, too, the ultimate chemistry set, the ultimate chemistry lab. Our body has everything inside of it that it needs to heal, everything that it needs to survive, and everything that it needs to be well. And what we just need to make sure that we're doing is putting our body in the best position possible to do that, to do what it's supposed to. And that's what chiropractors do. Notice I'm wearing a lifeguard t-shirt today. Think of a chiropractor as that, just that, your lifeguard, because your nervous system is your lifeline, your intelligence line to your entire body. So we as chiropractors work as lifeguards to guard your life, to guard your lifeline. Because what happens is we get those misalignments in our spine known as subluxations, and those interrupt that communication in our nervous system. So we unlock that pathway by removing those subluxations and allowing your body to do what it's supposed to. From the moment that we went from 2 cells to 75 trillion cells, our nervous system has been functioning. And our nervous system, our body has had that intelligence to do so. So what we need to make sure we're doing is putting everything in it that's going to help it and keeping everything out of it that's going to be bad for it. So that's what chiropractic does. Now, I'm going to share a story today on another reason of why I do what I do, why I am so passionate about making sure that we look at all different components of the body, all different components to health and wellness. This past December, I lost my grandmother, and when she died, it was due to renal failure. She had been diagnosed before with diabetes, type 2 diabetes, and then after that, high blood pressure, because we know that increased sugar in the blood is going to thicken the blood, making the heart have to pump harder, which is going to increase that blood pressure. So we see the effect of another effect of maybe an unhealthier lifestyle. Well, after she passed, my sister and I were given the responsibility to dispose of the medications that she was on. And what we found was something that really blew my mind. We found that she was on 23 different medications. This bag right here has all the bottles. Over 23 different medications. I want you to think about this. When I was younger, if I had twisted my ankle or hurt my knee during a dance class, and it was always, take some ibuprofen or take a Tylenol, then that'll help it. My question always was, how is this pill going to know to go to my ankle or go to my knee? How is it going to know to go there? Well, it doesn't. That pill doesn't have an intelligence. Your body has an intelligence. So what happens is that pill has to go into your body. The chemicals in that pill gets into your bloodstream, which of course your bloodstream goes throughout your body, and eventually those chemicals in your bloodstream will hit that particular area. But in the meantime, it's going to go through the rest of your body, including your liver, including your kidneys, where things are going to have to be filtered through. So after looking at this bag and going, okay, 23 different medications, no wonder her kidneys were shot. I want you to think about this. How many medications do you have in your medicine cabinet right now? How many times do you turn to a medication to give to your child because they have a fever? Fever, that reminds me. We have weekly wellness words starting this week here in the office, and this week our wellness word was vomit. I want you to think about this. I'm giving you a lot to think about today. If you go out to dinner and you have an amazing meal, everything tastes great, you're at a nice restaurant, and you pay quite a bit for your meal, and then 2 hours later, let's say you start to vomit. Does that mean that you're sick? Or does that mean that your body is well? What's the purpose of vomiting? Obviously, your body has something inside of it that it wants out. So it's going to get it out the best way that it can at that time, and that is possibly vomiting. So rather than being upset that you feel that you just wasted money on a fantastic meal that's just coming up again, why don't you thank yourself for being smart enough, your body being smart enough to get rid of what it needs to get rid of. Just because you feel sick, just because you feel like you're not completely well, doesn't mean that you're actually sick. It may mean that your body is actually working the way that it's supposed to. And we need to appreciate that, not fight it. Also, if we think we're well, if we think we're fine and we don't feel anything wrong with us, but we have to take medications for our systems to work right, does that mean that we're well? No, it doesn't. That's when we're sick. So as a lifeguard, as a chiropractor, what I'm asking you today is to ask yourself, who is your chiropractor? Who's going to be your lifeguard? And make sure they're watching over your life, the life of your families, and making sure that everything that you're doing in your life is conducive to how your body really works. Making sure that you're not doing anything that's going to prevent you from living a long, happy, healthy life. And especially those kids, making sure those kids are getting checked so that way they're learning from a very young age how to appreciate their bodies, take care of their bodies. So when they get older and they get to those times where things are a little bit more tempting to do damage to it, they're going to appreciate their bodies a little more and make wiser choices. So you'll see behind me, it's the well-adjusted jungle. It's my kids' play area. The kids that grow up in this jungle are going to be better equipped to handle the crazy jungle outside these doors. So find out who your chiropractor is. If you don't have one yet, give us a call here at the office, 602-569-7000. We'll help you find one. It may not be our office. Our office may not be the right fit for you, but we will help you find the right fit. If you're in a different state, still give us a call. We know chiropractors all over the world that we can connect you with and connect your families with. Everybody has a dentist. And a lot of us have our primary care physicians that we go to. I actually go to a chiropractor. My family goes to the chiropractor, me, to take care of them. But, I also have patients in here where I'm their portal of entry doctor. I'm the child's pediatrician, so to speak. And when there's something that needs to be taken care of, then we take care of it naturally with their bodies. So again, give us a call, 602-569-7000. We'll give you more information on how you can find the right chiropractor for you, and also give you information on the workshops that we're having on Tuesday nights at 6 o'clock from 6 to 6:30, more on healthy habits. Follow us on the website, www.phoenixfamilywellness.com, and follow our blog. We'll be having some tips there as well. So until next time in our next Wellness Wednesday workshop, continue to live well by eating well, moving well, and thinking well, because we want healthier families for a healthier future. Have a good one.